Hey everybody, it's episode 319. Make sure you stick around to the end because we are going to be going through a topic that all parents need to know about with their newborn babies. We're going to give you the real help to colic. Hey everybody, welcome back to the Prime Podcast. I'm your host, Dr. Skip Wyss, and as always, I have the beautifully, wonderfully radiant Dr. Julie Wyss with me today. Hey Julie.
Good morning.
How are you?
I'm good.
Yeah, I'm glad you're good today because this is a topic that can be pretty tough for parents. Today we're going to be hitting on colic. And colic is one of those things that can be extremely detrimental to both the baby and the parents. And the relationship. Very, very tough to deal with. Parents will feel like you're out there, you're on an island. You'll feel like you're the only ones that have children with colic. You'll feel like nobody's there to help you. You go in, you talk to your pediatrician. It's the same old story that it could possibly be acid reflux, that they're just going to grow out of it. It'll be gone by the time they're 6 months old, and it's not.
And that's where it's frustrating, it's heartbreaking, and all you want to do as a mom or as a dad is to make your child comfortable. And honestly, there's not much that you can do, and the old adage of that they'll grow out of it is just because within that realm they don't have options.
Right.
Well, there are options. They just, for whatever reason, don't understand it or don't agree with it, or just who knows? And so that's where I'm just really excited today to be able to kind of give that key, give that, piece of hope, because it shouldn't be hope. This should be a solution that more parents need to know about.
Well, yes. And I want to keep this basic today. So let's go back like we were in practice 15 years ago, before we knew everything that we know now. All of our certifications, all of our oral tissue certifications, all of these things that we've bolstered our knowledge with. We had success with babies with colic back 15 years ago when we were just adjusting them.
Just adjusting.
Yes, just adjusting. Well, what that means is that we were exclusively just checking their nervous system and making sure that communication is key. And sometimes colic, acid reflux, indigestion, constipation, all comes back to something as simple as getting the nervous system checked. And it's not as complicated as what people think. It is serious. Nervous system interference, the inability of the brain to talk to the body, changes the function of the body. It is a serious issue, but it is very simply solved.
And I think that's what makes it so puzzling to some people, or just like, well, it can't just be that.
Yeah.
Because like it's usually when something's going on, like, well, what can we put into the system? What can we take away? What can we do? All of these other outside things, when it's really the inside that needs help. And it's one thing. It's proper chiropractic care. It's a pediatric adjustment.
Exactly. And it seems simple. And a lot of the times, like you said, you got to be able to find the simplicity through complexity, to quote Amy Spolstra, very good friend of ours, Dr. Amy, with her Focus program. But it's the simplicity to solving and helping the problem, because the little baby's body is designed to heal themselves. And that usually is what gets chalked up from allopathic providers, that they just grow out of it. No, it's a healing mechanism, but if they can't effectively heal it, it changes what's going on with the kid. And the first thing we want to look at then, and you guys have heard us say this, is what we need to look for when a baby is born is their ability to hold their head and turn it. Can they turn their head from right to left? Can they actually hold their head up well? Do they have good head control? If they don't, that is a major sign of their upper neck not being in the right position. And that upper neck is where it controls and it's what houses all of the natural circadian rhythms and primitive reflexes that the child has in order to feed properly. And if we can't feed properly, then we get a change in how we digest. inappropriate digestion with colic, acid reflux, whatever you want to name it, is an inability to digest food.
Mm-hmm.
And to digest breast milk or digest the formula that the child's being given. And that is the result of the nervous system not communicating properly to digest that food.
And I would say like this is like the first warning sign is, let's say like after baby that you want to breastfeed.
Mm-hmm.
And that first sign is, well, I can only get baby to latch on one side, not the other side, or I can't get baby to latch at all, or I have to do like the football hold and lacrosse cradle on the other side, or there's all of these things. So these are like those red flags that you notice that, okay, I wanted to breastfeed and I can't. And it's usually well, it must be my supply.
Yep.
Lots of times supply gets affected because baby can't appropriately latch.
Yes.
So like that's like red flag number one of like, okay, what the heck is going on? The second, as you were talking, is when you notice that maybe baby has a flat spot or
they're developing one.
Yep. Or a bald spot on the back or the side of their head. That's another like indicator of like the system's trying to, it's like a gear that's stuck, right? It
Yeah, that's a great example.
It keeps slipping and then like the grooves start to wear away. Well, that's what's happening for your child when they can't turn their head. And so you're noticing that red flag number 2 is the bald spot or lack of hair on that side. When you try to talk to your child, right? The head should at least be able to go back and forth. They may not be able to see you, but they can hear.
Yep.
And so they should be able to track with you or to see that eye movement. And if we see again that we're getting a partial, red flag number 3 is that they can't follow you or follow your voice or be alert and attentive to that.
Yeah, and that is a massive sign. That was awesome. I really like that. And I like the example of that gear getting stuck. And, it's not just a bald spot. Like when it's a bald spot, that means they're thrashing their head back and forth and literally wearing their hair off in that spot. That's not okay. That's a direct external sign, kind of like seeing eczema on the skin for a baby that tells you their liver is not working correctly. And I know this sounds counterintuitive at times because your pediatricians will not recognize that there's nerve interference because they don't know how to check it. It's not that they're undereducated. This is not in their wheelhouse to check, diagnose, and help. Like that is, finding subluxation is what chiropractors do. It's not what physical therapists do. It's not what OTs do. It's not what your lactation consultants do. They don't check the nervous system. We do. And the nervous system is the master control for all of it. And it's the master control for how your baby is going to respond the rest of their life. Because why would something's sole purpose to digest food and get you nutrients and help you survive, it has to feed the brain. The brain needs the food, it needs to have the glucose to function, all of a sudden not want to do it. Why would it just malfunction? Why would it just short out? Why would your baby not want to eat, digest food, not spit up? Like why would the body all of a sudden just start rejecting the thing that it needs? It doesn't work like that. So there has to be a short in the system. There has to be a miscommunication in the system. And that is what's leading or resulting in your child having colic. Chiropractors have the answer to this. We have since 1895 is getting that nervous system back to restoring itself. And, I think that tongue ties and lip ties, they are very serious. We have to hold space for them. But you know what? Not all of them need to be cut out of the mouth. Not all of them need to be released. There's a lot of soft tissue that can be worked on. Yes, that's another layer to understanding a latch issue.
But again, there's the neurology that
controls all of it.
Controls the tongue. So you have that revision. We still need to work then on that neurology of retraining the tongue for the proper latch, like the mechanism. And even if you're not breastfeeding, if it's bottle, this is going to come down the road if you're doing baby-led weaning or any types of feeding to get that tongue doing what it needs to instead of expelling the food to bring that food in. So it's not just do this one thing and it's going to be fixed. There's multiple layers that need to be addressed.
There are. And, tongue ties, lip ties have gained a lot of popularity. And I feel that we're kind of, as chiropractors, especially at Prime Family, I don't want to say we're the culprit of that, but we've brought a lot of awareness to that in the last 10 years. Like it's what we talked about. But again, if you see somebody that goes and removes those tissues in the mouth and they tell you, well, don't worry, baby's going to relearn how to latch. Well, what happens if those nerves that directly control that tongue that come directly from the brain out of the skull to the mouth? If that skull isn't in the right position, if that neck isn't in the right position, those little tiny, tiny holes where these nerves exit will be out of position, and that will negatively affect how they talk to the tongue and then control its motor pathway. And we need to make sure that that pathway is clear and that communication is crystal clear, so the tongue can then learn the right motor pathway, which the brain has involved and laid down because it's been learning how to breastfeed since 23 is in utero in you, mama. So why do we not hold space for that to make sure that that is checked? It's a big deal. Instead of just going in again and treating things allopathically, removing tissue and trying to remove and fix a symptom versus find the actual direct cause as to what's causing this. Now, excess tissue in the mouth could be a cause.
Correct.
But we need the neurology to come back in and make sure that's crystal clear, at least get them checked. Don't necessarily need the adjustment. Make sure they're checked. And if there's interference, then adjust the child and make sure we're cleared out.
And I would say in a few instances, that it could have just been structural with the excess tissue, that then the tongue is ready to go. But that's not usually how that works. And so within the medical realm, like there's so many other keys and pieces to this puzzle, but then it's also, well, here locally, the CP center and these therapists, like everybody is bombarded with this wait list. And yes, that's a part of it. But if we can step back we can do all of these things, but the one thing that attaches and brings everything together is the nervous system. And that's a pediatric chiropractor, because we can do the revision, we can see the MD or the pediatrician, the dentist, we can go to OT, we can go to PT, and they can all help with the movement. But the brain, that's what controls all of this. So that needs to be a piece of the puzzle. And I think that's what so often gets overlooked and the exhaustion comes in of like, I've already done all of these things. You're my last hope. Well, let's reverse that and let's start with this so we can get the right signals. We can get the right communication. We can get the right nerve pathways. So then we can all work together as a team for the best results for your child.
Yeah, I agree with you 100%. Now, let's dive into a little bit of the stomach function role, because a lot of the times you'll go in, moms, and you'll take your baby in, and let's be honest, if your baby's been crying nonstop for the last 6 weeks, because 6 weeks is generally when we see them come in. When we see moms come in with babies, it's 6 to 8 weeks, which tells me you're exhausted. You've been dealing with this for almost 2 months, and you've tried the gripe water. That's got a 50-50 chance of actually working. You've probably been given an antacid or some sort of acid reflux medication to give your baby. That may or may not have worked. You've literally got a 40-60 chance of that actually being the resultant, or it may make it worse. But the thing that we want to keep in mind is that your baby's stomach isn't producing a lot of acid early on. It's not ready to do that yet. It's not an
acid issue. And that's
not
usually
an acid issue.
If you started breastfeeding is now out the window. That relationship is gone, and you're usually on like the third or the fourth option of formula.
You are, and you've already probably been told too, well, let's do this, and then they when you buy formula, it'll say AR. AR means added rice, or it'll be called like soothe this or soothe that. There's rice in it. It's thick. Why would I try to thick up a situation, thicken something when it needs to be thinner, when it needs to pass through the stomach, digest itself, get into the GI tract and get absorbed? And typically then we'll be seeing kids that have colic. Constipation goes with the same thing, constipation, diarrhea. And that, if it's backed up, if you're backed up, you will spit up. We see this in adults too. It's called an ileus in an adult, where the GI tract isn't working correctly. It's slowed down. It's not digesting at all. Constipation will be a resultant of it, but there is something medically called an ileus when the GI tract just stops working altogether.
Why would you want to put porridge in there, right? And to make that worse. And so again, the baby is just responding for survival. And so it's the outside sources that we need to figure out, okay, how can we get that tummy working? And that's where that comes up to the oral palate, getting that communication, making sure the tube, from the mouth to the hole is working appropriately. And that's just, each of the nerves that control each of those areas, that's what needs to be addressed.
Yeah, and chiropractic's going to help address that because the
Mhm.
brain's going to come in and get the entire system working and talking together. It's a plumbing issue. We need to figure out what's controlling the plumbing, and then how do we get the master control back to controlling the plumbing. And we're really good plumbers. We know how to find it, figure it out, fix it so the body starts actually healing like it's supposed to. That's the thing is that the master healer is the body. It's the child in front of us. We just need to get certain things back into communication so the brain can heal like it's supposed to. Now, the other side of this is that moms will be told that it's an issue on them, where it's a diet issue. And typically when we have moms come in, they've tried to eliminate as much as they can, but the one thing that they don't eliminate is dairy. And then they get told they have to eliminate dairy, and they get this massive gut drop where they're like, how do I do that? Well, let's look at it from a standpoint of how much dairy do you actually consume in a day? A lot of people don't consume that much dairy. So it's actually fairly simple to eliminate it. You don't need yogurt to survive. You don't. A lot of our moms eat yogurt, or they'll be taking in protein. A lot of our moms will be taking in protein smoothies to help supplement nutrition and get things down for themselves, but also they're trying to drop weight early, which you shouldn't be doing.
Well, and I think the big thing to address here is it's not like it's a life sentence that you can never have these things again. However, some of these things will be great for you to decrease and to never have again. That's a whole different podcast. But this is also okay, let's try, like we like to, like the least invasive, right? So it may seem cumbersome, it may be difficult to do, but we need to do it at least for 6 weeks to see if it's going to start to change. And if there is no change, then okay, great. Then maybe we can go back to reconsuming, those items. But it's not a like, oh my gosh, for the rest of my life. No, it's this little window to see, okay, can this help to make a little bit of a change? Like breastfeeding is really important for me, so I'm willing to do this. And then after that certain point, then you get to have that back. So it's also that give and take of, okay, I want my baby to be super healthy. Okay, so I'm gonna have to make, a couple of adjustments in the things that I'm doing. I'm not giving it up forever.
Well, here's the thing. You start giving certain things up. Like let's say you stop taking in dairy. You might find that you're less snotty. You might find you're less sinusy. You might find you're less bloated. You might find you're less gassy.
Or those skin patches that never went away, and all of a sudden that's healing up.
It's a huge deal. And this day and age, it is so easy to not bring dairy in. There are so many alternatives, and I don't want to say alternatives. There are so many different things you can consume for protein besides dairy. And that is actually better for you, that breaks itself down in your system better, and that actually helps feed your body better. And those are the things. So when a child is going to the bathroom and they're constipated, diarrhea, which is it's either one or the other, and you're noticing mucus, you're noticing snotty bowel movements, they might be real green. You may notice some blood in there, red blood. That's all signs that they're having some sort of sensitivity to what's in your diet. But the number one culprit is dairy. It's generally not gluten. It's dairy. It's dairy. And that casein cannot break itself down. So moms out there, if you're consuming things, and let's say you are trying to be super proactive and you cut dairy out, but you might notice that you haven't completely cut dairy out because you are consuming a protein powder. Most of the time, those protein powders are dairy-based. You're going to want to find a pea protein. You're going to want to find something from like buckwheat, something that's an alternative.
And that's where we have all of those options because some people just like certain things, and that's what makes it so amazing. Like in today's world, that there are so many options, which can also be super overwhelming, and we understand that too.
And I'm telling you right now, this one is full of information. There's a lot of, we may have said a couple, I wouldn't say controversial things, but definitely different than what you've been told. And there's an answer to this. Chiropractors have a solution, and that solution is inside your baby to heal itself. We just need to check their nervous system and help them out. I'm not telling you we have a perfect cure, but there's an amazing solution to that body functioning like it's supposed to. And when the body starts functioning and healing like it's supposed to, we see a lot of these things start to change.
We aren't made with too much
or
too little. So everything is within us to be able to do it. Sometimes it just needs some guidance and some help.
So I'm going to make a suggestion. every one of you out there listening, all of the people that jump on here, listen to view this on YouTube or listen to us on all the different Spotify and podcast channels, share this one. This one is tremendously educational. This will change somebody's life in your family. This will change a kid's life. It will change a parent's life. It might even save a marriage. And that is so important. So share this to as many people as you possibly can. Give us a like, subscribe. Just get this out and help as many people as you possibly can. Dr. Julie, you got anything else today?
No, it's perfect.
You guys have a great day. Go out there, get it done. Have an amazing week. Bye, everyone.